York Governor Kathy Hochul announcing several new initiatives to increase access to maternal health care.
That's right. Among them, a first-in-the-nation prenatal paid leave law and the expansion of doula services. Fox 5's Teresa Perolo joins us now with all the details on this. Teresa.
Hey, Bianca and Steve, Kathy Hochul said she was coming at this from a mother's perspective, somebody who knows what access to care looks like, and she hopes these new initiatives, including the expansion of a health clinic in the Bronx, will give that to pregnant women who might not otherwise have it.
This is a crisis. Full stop.
As the state's first female governor, a mom of two, and a grandmother, Kathy Hochul is hoping her legacy also includes the acknowledgement that maternal health is a top priority.
This is heavily concentrated in black and brown communities, and women have 3 to 4 times higher rate of mortality than women who are not women of color.
Hochul put the spotlight on pre- and postnatal care in the Bronx, a place with some of the highest maternal and infant mortality rates in New York State. Her announcement kicked off with a massive cash infusion to expand the Morris Heights Health Center.
While you're sitting here, to close the gap, you need to expand the Morris Heights Health Center and bring back the services. $8 million for you today.
In addition, she announced unfettered access to doula services, an extra layer of care to prevent avoidable deaths.
The stories we heard, a 30-year-old woman being treated last Friday, had a baby, went home. On Monday, she's not feeling well. She's feeling sick. The doctor says, I'll see you at the next visit in a few days. She calls her doula, who says, I'm coming over, that doesn't sound right. That night, she was admitted to the ICU and spent a week there, and they saved her life. She ended up having congestive heart failure.
A 2021 CDC report found approximately 20,000 infants died in the U.S. from pregnancy complications, injuries, and other preventable issues. There were 22 maternal deaths for every 100,000 live births in the U.S. It's why the Bronx first female borough president, Vanessa Gibson, has been pushing for access to care.
We also do this in honor of those women that we have lost in our battle. We do it because we carry on their legacies. Women that look like us have died during childbirth because of pregnancy complications. And we are honoring their work, and we are making sure that their deaths are not in vain.
So the governor also announced up to 20 hours of paid time off from work for prenatal care. That includes doctor's appointments, which oftentimes women go to as unpaid work time, or, Bianca, they simply miss.
That's true. That's true, and it's unfortunate. We'll see how that works out, though. Thanks so much, Teresa.